Metzenbaum.
Dr. Coop, Dr. Windeman, I do appreciate the kind of leadership you provided in this area and your willingness to speak very bluntly and openly about that which is obviously one of the most challenging medical problems this nation has faced in many a year. I am particularly concerned about the problem of AIDS with respect to children. Since 1981, there have been 308 cases of AIDS in children, 187 of whom have died. There are estimates that there are 2,000 children who are inflicted with AIDS but not yet sick. Most children got AIDS from their mothers who are drug addicts. Some children were infected through blood transfusions. Some estimate that 100 to 300 babies with AIDS have been abandoned in hospitals by their parents, most of whom are drug addicts. And the fact is that efforts to place these children in foster care or to set up group homes for them have run into community opposition. Now, in the last session of Congress, I succeeded in getting attached to S2345, an amendment that would instruct the Secretary to undertake a survey to establish the following. A, the number of children with AIDS nationwide who have been abandoned by their parents and who are living in a hospital environment. B, the number of such children who have been placed in foster care. C, the problems being encountered by social service agencies in placing children in such care. And D, recommendations for improving the care of pediatric AIDS cases who lack ongoing parental involvement and support. I can't think of anything sadder than a little child that has AIDS that is rejected. Nobody wants the child. The child is probably not even aware in some instances that he or she is being rejected, too young to comprehend that. And my question is, A, even though this amendment was adopted by the committee, the bill itself never passed, and whether or not your office might be willing to provide that information for us so that we might see what we could do from a legislative standpoint to help you. I think if we don't get at the facts with respect to the number of children afflicted with AIDS, we're going to have great difficulty in dealing with the issue.
Well, Senator, I think you remember that my background is pediatric surgery, 35 years, so I share your concern about the children. And although I am not in active practice, I still maintain lines of communication with my pediatric colleagues. And the question you've raised is, to them, a very serious one. One of the problems in a city like New York is that so many babies born to cocaine addict mothers or to parents who, mother who has AIDS are abandoned. And I suspect that your estimate is probably low, sir. I'll tell you what's going on in government in reference to trying to come to closure on this issue and answer some of the questions that your amendment wanted to seek. There will be a meeting next month in Atlanta at the Centers for Disease Control on children's AIDS, and I have been working for several months now pulling together a Surgeon General's conference on AIDS in children to be held at the Children's Hospital of Philadelphia in April. And I think by the time May rolls around, we'll have most of those statistics that you wanted, and I hope we'll have in place in the private sector better means of coping with the abandonment problem and better means in social service of finding some kind of foster care. The major problem with foster care, Senator, is that the stigma of AIDS and the misinformation that it is transmitted by non-sexual casual contact is the barrier to taking care of these youngsters. But I think we can overcome that.
And you understand that as a result of these meetings, that probably by about May or later in June, most of the information that we would have obtained through our amendment will be forthcoming?
Yes, sir.
Good. Now, according to a recent press report, an anonymous AIDS testing site in Manhattan has a waiting list that's 2 months long. What is the situation as you understand it to be with respect to testing? And can people in high-risk test groups, in high-risk groups, get tested promptly so that they can have the test without being exposed to the embarrassment and some of the other problems that are obvious, since it does have a kind of stigma attached to it? is there any way that you could suggest a procedure so that at a minimum there would be available testing sites where people would be able to protect their identities?
Well, I'd like to think that that flurry of enthusiasm about voluntary testing, sir, perhaps is in response to the Surgeon General's report that encourages voluntary testing rather than compulsory testing. And it is naturally a problem either for the state or municipal health department. I think the problem is greatest in New York, and I think the backlog you mentioned will be caught up with on the basis of what things I know. I don't see where the federal government can get into that local jurisdiction in any way except to give advice and help when asked for.
Can the federal government be a prod? In other words, if you live in Atlanta, the fact that there is a testing site in New York doesn't help you. If you live in Denver, the fact that there's a testing site in Cleveland doesn't help you. And it seems to me that in these conferences and these meetings that you're holding, that might be an item on your agenda to at least be an advocate or a prod that there be established wherever possible these testing sites where people can protect their identity.
Well, all the people that should hear that message are in the audience this morning, sir.
Now, before Dr. Wyndham, your testimony outlines many of the activities underway by the public health service relating to AIDS. And I'm glad to see that. I think that you're moving very definitely in the right direction. However, before we congratulate and is it only now starting to respond very actively?
I think, sir, that the administration has responded very well and is progressing each year, realizing more and more the importance and the significance of this disease, and is asking for even more money for fiscal.
Well, how did Dr. Philip Lee, who was the former Assistant Secretary of HEW, recently wrote, quote, "The Department of Health and Human Services has failed to give firm direction to the efforts to understand and control the disease, and it has provided no overall strategy or program to guide physicians in how best to care for AIDS patients." How do you respond to that charge? I want to say that I think the recent report is excellent, but we're talking about an ongoing program in yesterday rather than today.
Yes,
and is
sir.
there a definite change?
We are very actively involved through a number of our agencies, and our Centers for Disease Control publishes weekly a morbidity and mortality report that features AIDS very often, and that's published in the Journal of the American Medical Association and other publications. We have cooperated also with physicians in putting on combined conferences throughout the nation for education and information to them. So I feel that we are very actively involved in educating the medical profession.
I'm always concerned about the possibility that there's a lot of research going on, but it fails to have any coordination. I remember many years ago, as a private citizen, I was administration too hardly on its response to AIDS. We can't forget that in the initial fiscal year 86 budget proposal called for a reduction in AIDS research and related spending. Has the administration been slow to respond, and is it only now starting to respond very actively?
I think, sir, that the administration has responded very well and is progressing each year, realizing more and more the importance and the significance of this disease, and is asking for even more money for fiscal.
Well, how did Dr. Philip Lee, who was the former Assistant Secretary of HEW, recently wrote, quote, "The Department of Health and Human Services has failed to give firm direction to the efforts to understand and control the disease, and it has provided no overall strategy or program to guide physicians in how best to care for AIDS patients." How do you respond to that charge? I want to say that I think the recent report is excellent, but we're talking about an ongoing program in yesterday rather than today?
Yes,
And is
sir.
there a definite change?
We are very actively involved through a number of our agencies, and our Centers for Disease Control publishes weekly a morbidity and mortality report that features AIDS very often, and that's published in the Journal of the American Medical Association and other publications. We have cooperated also with physicians in putting on combined conferences throughout the nation for education and information to them. So I feel that we are very actively involved in educating the medical profession.
I'm always concerned about the possibility that there's a lot of research going on, but it fails to have any coordination. I remember many years ago, as a private citizen, I was national co-chairman of the Citizens Committee Commission or something to conquer cancer. And I had the feeling that there was not that kind of coordination that was so important and so vital. What kind of federal supervision do we have today to coordinate the various clinical investigations that are underway at this time?
Senator, we have a very active program among the 5 agencies of the Public Health Service, a coordinated research task force looking at drugs, vaccines, and also biomedical basic science research, and it's ongoing and increasing its efforts all the time.
How much of the current research is being funded by private sector companies with federal dollars?
Well, there are grants that the Public Health Service makes to private institutions for research scientists to do research there, and with that grant from the federal government, they in turn also have either state or private funds. I don't have a figure, Senator, at this moment. I can get that for you if we could figure out the exact numbers. I don't know that.
I would appreciate that figure. Now, let me ask you, the FDA considers this research, as I understand it, proprietary, and therefore that information cannot be made public unless the company agrees. Is that correct?
Unless the company...
If the federal funds are used and the private drug company that conducts its investigation, the FDA, as I understand it, considers the results of that investigation proprietary, and that the results cannot be made public unless the company agrees. Now, am I misinformed on that?
Are you referring to the studies that are presented and the information to the FDA for evaluation of drug studies?
Well, I'm talking about the research being done by the private
Yes.
sector with federal funds, and then the submissions to the FDA for approval to market, and the question of where do the public dollars fit into that picture, and where does the public interest fit into that picture?
Well, the public dollars, of course, in certain instances are not involved at all because it's strictly private by a drug company, or if it's in collaboration with studies that are being done at our various health agencies and National Institutes of Health, the federal government is involved in helping direct those research studies, and clinical trials. And then in combination, the drug goes to the FDA to see if it's approved for general use and then given to the public. I think there's definitely a correlation in
Well,
both
my
instances.
concern is, and Chairman has pointed out my time has expired, but my concern is that federal dollars used, private company using it, conducting the research, then gets to a point where it wants to go to the FDA, and at what point does this information become available so that not alone that company can use it, but other companies as well, and that it becomes a matter of public interest being served?
As soon as that evaluation has been completed
Pardon?
As soon as the evaluation has been completed to determine that that drug is safe and effective, and then it goes to the public. I'm not aware of any reason that would be withheld.
No, but I'm talking about the steps before it gets approved by the FDA.
Well, it has to meet certain criteria of clinical trials to be studied in human beings, and that has to be approved by certain guidelines. Some studies are done strictly private, others are done in combination because of the work through our National Institutes of Health.
Well, I have some further questions on this because I'm not sure I'm satisfied with your
Okay,
response, but
I'll be
we
glad
can
to
talk further
try to
personally.
clarify that later. Thank you.